So it's so important that if you have any issues or signs of depression or anxiety or attention problems or learning issues or things that you are struggling with, substance abuse, even that are raising in your consciousness, like maybe this is a problem, this is the time to ask. Ask your healthcare provider, ask a behavioral healthcare provider, check out Access Health Connecticut website, and try to get to the resources that you need. And you can visit the Access Health Connecticut website for help. You can look at screens like that, but there are symptoms that come along. And for some kids, it's initiating. They have a hard time starting their homework, or they have a hard time doing the same list of chores that they always do, or the same routines in the morning. You're thinking, we do this every morning. How can you forget to pack your backpack? But it happens because in addition to attention being a problem, when you have an attention disorder, your executive functioning gets in the way. And executive functioning is sort of like being an executive, all the individual steps you need to take to do something. So you think, well, they're just rude, but think about it for a minute. If you wanted to get a glass of milk in your kitchen, you'd have to walk to the cabinet. You'd have to open the cabinet. You'd have to choose a glass. You'd have to take the glass out. You'd have to put it on the counter. You'd have to close the cabinet. You'd have to take the glass. You'd have to walk over to the fridge, etc., etc. So for kids, that's the teacher says, don't forget, do chapter 6, number 1 through 15 for homework, odd numbers, but you can skip 9. It's gone. And so for most of these kids who have an attention disorder, they're visual learners. So there's so many things, if we identify it, that we can do to help these kids.